going to discuss about some important MCQ on phlebotomy. Hi everyone, I am Manoranjan Barman and I welcome you to my YouTube channel. First question, which phase of laboratory workflow is phlebotomy in? Options are analytical, pre-analytical, post-analytical and follow-up. What do you mean by analytical? Analytical means it is the part where the analysis is going on. Analysis of the sample is going on. That means the laboratory experiment part is going on here in the analytical part. Pre-analytical means before the experiment, before the analysis part. Basically it includes the sample collection, patient preparation. Post-analytical means after the analytical phase. After the analytical phase, it includes reporting and follow-up. Follow-up means if patient comes for further investigation. Further investigation means follow-up. So out of these four, phlebotomy will be related to this pre-analytical phase. This is the correct option. Next, the phlebotomist had to gently redirect the needle several times before entering the vein. This may cause error of result. Which of the following tests will show error? It means while inserting the needle, the phlebotomist was not able to find out the vein properly, so he tried several times to enter into the vein, then finally he got the vein. But this may affect which result? We have options: coagulation profile, RPR, glucose and CBC, complete blood count. So I'll start with option D, complete blood count, CBC. If the needle rub any tissue, it won't affect the CBC count usually. Glucose level also will not be affected. Not affected. RPR means rapid plasma reagent, which is screening test for syphilis. So RPR test will not be also affected. Coagulation test will be affected. How? See, platelet count will be affected. If the phlebotomist redirect the needle before entering the vein, that will lead to some small injuries to the tissue. So these small injuries will attract the platelets and the platelet will start forming platelet plug. So some of the platelets will form plug. As a result, the platelets in the blood will be slightly lower than the actual platelet count. So there might be some error in the coagulation profile, especially the platelet count. Improper or unskillful care of patient by member of the healthcare team is negligence, professional attitude, malpractice and proper identification. Proper identification is not related to the improper or unskillful care. Malpractice means doing something illegal or improper, or not doing correctly. Professional attitude won't be applicable. Negligence is different and malpractice is different. Negligence means they are ignoring. It's ignorance. So the correct answer will be malpractice. Next question. Light blue top tube contain sodium citrate and are used to collect blood specimen for. So light blue is used for basically used for which test? For CBC we used EDTA, K3 or K2 EDTA. For coagulation studies like PT, APTT and coagulation factor assays we use light blue vacutainer, which contains sodium citrate. Blood sugar, for blood sugar estimation we use gray top vacutainer. So the correct answer is coagulation studies we use light blue top vacutainer. Next question. Which needle gauze has the smallest diameter? Look at these numbers. 21 gauze, 23 gauze, 25 gauze and 15 gauze. If we talk about gauze, the concept is slightly different. More the gauze, less the diameter. More the gauze, less the diameter of the needle. Just remember this. 25 is the largest number. That means it is the smallest diameter needle. So correct answer is 25 gauze. If we ask which one is the largest diameter gauze out of these four, then your answer will be 15 gauze. Moving on to the next question. Blood is mainly composed of cells and plasma, cellular elements and plasma. The cells are RBC, WBC and platelets. Plasma composed of mainly around 92% water and the remaining are some solutes. All the vitamins, glucose, nutrients, protein, all are present in the plasma. So blood is composed of RBC, WBC, platelets and plasma. So we got options here: RBC, WBC, platelets and all of the above. The best option is all of the above. Moving on to the next question. What are the different sources of blood? If we want to investigate blood, we need to collect blood. We can collect blood from various sources. We can collect blood from veins, which mainly composed of deoxygenated blood. That blood is known as venous blood. We can collect blood from arteries, which carries oxygenated blood, and those bloods are known as arterial blood. And we can collect blood from capillary also. Capillary blood can be collected from fingertip. That type of blood is known as capillary blood. So the best option here is all of the above, because you can collect blood from all these three sources for the laboratory investigations. Next question. Name of the most common vein in the antecubital fossa where venous blood can be collected. So antecubital fossa, I'm very bad in drawing, please don't mind. This is the antecubital fossa. There are three important veins from where we can collect venous blood from the antecubital fossa. From this part we got three veins. One is median cubital vein, another is basilic vein, and the third one is cephalic vein. So out of these three veins we can collect blood from these three veins, no doubt, but which one is most commonly used for collection of blood? That is the median cubital vein, because median cubital vein is slightly larger than the basilic and cephalic vein and is more stable. So any phlebotomist who is collecting blood, they will try to collect blood first from the median cubital vein. If they fail to find the median cubital vein, they can then go for basilic vein or cephalic vein. So the best option is median cubital vein. Moving on to the next question. What is the site of venous blood collection? Your answers are earlobe. From earlobe usually we can collect capillary blood. Capillary bloods are collected from earlobe, tip of your finger, antecubital fossa. Antecubital fossa is just before a minute I showed you. This is the antecubital fossa. So from this part we used to collect venous blood. So this is the correct answer. But still I would like to discuss the other points also. Heel prick. Heel prick also can be used for capillary blood collection. Capillary blood collection, especially for infant. If you want to collect capillary blood in infant, then you can perform heel prick. None of the above is not applicable here. So the best option here is B, antecubital fossa. You can collect venous blood from antecubital fossa. Next question. What is the site for capillary blood collection in infant? Just before a minute I have told you the site for capillary blood collection. In case of capillary blood collection, there are different sites. In case of adult we use finger prick, earlobe. In case of infant, heel prick is the best option. So earlobe won't be applicable because the question is asking capillary blood collection in infant. Heel prick will be the answer. Finger prick is not applicable in case of infant because their fingers are very small. It is not possible to prick their finger. And venipuncture is not applicable because we are talking about the capillary blood collection. Now moving on to the next question. Arterial blood can be collected from, your options are pulmonary artery. Pulmonary artery is connected between heart and the lung. In between heart and lung. So it is not applicable. Axillary artery, you cannot collect blood from axillary artery. Then next, hepatic artery, it supplies blood to the liver. And which one is left? Femoral artery. Femoral artery is present in the leg, especially the femur part. From the femoral artery we can collect arterial blood. There is one more artery from where we can collect arterial blood, that is radial artery. Radial artery is again used to check your pulse. Please remember. Next question. What is the site for capillary blood collection in adult? Just a few minutes ago I have discussed the capillary blood collection. So I think you'd be able to answer this. Antecubital fossa is not applicable because it is capillary blood. Fingertip will be applicable. Heel prick is not applicable because it is collected only in infant. None of the above. It is not the best answer. So the correct answer is fingertip. In case of adult, we used to collect capillary blood from the fingertip. Moving on to the next question. What is tourniquet? A constructive band used for venipuncture and intravenous injections. A needle used for venipuncture and intravenous injections. A constructive cuff used to measure blood pressure. No, it is not used to measure blood pressure. Neither. It is a needle for venipuncture or intravenous injection. So this is not applicable. All of the above is not applicable. The correct answer is the first one, A. A constructive band used for venipuncture and intravenous injection. While collecting blood, we use tourniquet to make the veins prominent. Which of the following procedure tourniquet should not be used while collecting sample? So evacuated tube with butterfly is not applicable because if you are using butterfly needle, you need to use tourniquet. ABG means arterial blood gas. Arterial blood gas. Syringe draw you need tourniquet, so it is not applicable. Blood culture, for collecting blood for blood culture you need tourniquet, so it is not applicable. The correct answer is ABG, arterial blood gas. Arterial blood gas is done for checking partial pressure of oxygen, carbon dioxide, etc. So the best answer is B, arterial blood gas. Moving on to the next question. Which vector is selected for reticulocyte count? For reticulocyte count, red top vector cannot be used because red top vector we use for serology. For serum preparation, we use red top vector, so it is not applicable. Light blue top vector it is used for coagulation study. For like PT, APTT, we use light blue top vector. Lavender vector is used for CBC, complete blood count, HbA1c, that is the glycosylated hemoglobin, which is done for diabetic persons, and reticulocyte count is also done with the lavender top tubes. Let's talk about black top tube. Black top tube is used for ESR. Estimation of ESR, we use black top tube. Black top tube contains 3.8% trisodium citrate. So the best answer is option C. Lavender top tube is used for reticulocyte count. Next question, which vector will select for blood collection for ESR? Just before this slide I told you ESR is performed with the black top vector, so this is the correct option. Red is not applicable, lavender is not applicable. Lavender is used for CBC, HbA1c and all. Next question, a purple top tube contains EDTA as an additive. Which of the following is the most likely mechanism of action of the EDTA? The action of EDTA is actually it removes calcium. It removes calcium and form calcium salt. Calcium salt. So if we remove one of these, this is the fourth clotting factor. So if we remove this clotting factor, calcium, and form calcium salt, the blood will not clot. Let's look at the option. Inhibit glycolysis within RBC. It is not applicable because glycolysis is not related with the clotting mechanism. Inactivated thrombin in plasma. So if we inactive thrombin in plasma, then also the blood will not clot. But the mechanism of EDTA is not that. Thrombin can be inactivated by heparin. None of the above is not applicable. So the best answer is it removes calcium by forming calcium salt. Next question, all of the following additives prevent blood clotting by binding with calcium except which? That means all the anticoagulant, it remove the calcium and prevent blood clotting, but which one is not doing that? See, all these three, EDTA, potassium oxalate, sodium citrate, it helps to clot by removing calcium as calcium salt. I have just told you before, heparin is not doing this. Heparin, it inactivates thrombin and it helps to prevent clot. So the correct option is heparin. Then the last question is, a grey top tube contains sodium fluoride. Which of the following is the most likely mechanism of action of sodium fluoride? Sodium fluoride is used in the grey top tube. Grey top tube, that is used for blood sugar estimation. That is used for blood sugar estimation. And the important thing is, in the grey top tube we use potassium oxalate as an anticoagulant, but we use additive as sodium fluoride. The function of sodium fluoride is to prevent glycolysis. It prevents glycolysis so that the RBC cannot use the glucose from the blood. The main purpose of sodium fluoride is to prevent glycolysis. So the first option, inhibit glycolysis, it will be the correct option. Let's have a look at the other option, activating thrombin to prevent clotting. It is not applicable. Form calcium salt to remove calcium, no, not applicable. Prevent microbial growth, it is not applicable. This is the first part of the phlebotomy MCQ. So I'll try to carry out some more parts, and I thank you for watching this video, and please like, share and comment, and those who are new to my channel, please subscribe to my channel. Again, thank you so much.